are more in favor of mystical things, like we really like poems, comparing to Western ethnicities, which are more logical and evidence-based. It is what it is. And it is evidence-based that the physiological basis of the brain changes during the hypnosis. One of the most instruments which has used a lot in hypnosis has been MRI, fMRI, or functional MRI. And it has been shown that in hypnosis, the physiological basis of the brain changes. These are a little bit more. And what are the three main basic methods of hypnosis? The first one is the use of imagination. Everybody can imagine, and highly hypnotizable patients, by definition, are categorized in two broad branches. The first branch is highly imaginative people. So people who are highly imaginative can be highly hypnotizable. The other set of people who are highly hypnotizable are dissociative people. They are disconnected during the hypnosis. You cannot keep the relation with them because they are somewhere else. And the second method of inducing hypnosis is suggestions. You know, that's the final goal in hypnosis. Hypnosis has different phases. The first phase is initiation or induction. The second phase is deepening. When somebody is hypnotized, you deepen the trance, and then you suggest. Suggestions is the most important part during the process, because you do the therapeutic approach through suggestion. And the most fascinating part, the unconscious part. As you know, most of our consciousness is beyond our access. And you know, maybe there is something called collective unconsciousness, and maybe we all are connected during the collective unconsciousness beyond these appearances. And hypnosis is a strong instrument that helps us to tap into that collective unconsciousness. And we should know that hypnosis is just a therapeutic modality. It's not a miracle, it's not magical. It's something like other modalities. One of the most important applications of hypnosis is pain control. And it's quite common to use hypnosis in pain control in cancerous patients. There are a lot of literature support for pain control. This is the affiliate of Belgium. Because this presentation is prepared for hypnodontics, or the application of hypnosis in dentistry. This is about one of the important indications of hypnosis in dentistry, which is the temporomandibular joint dysfunction and headaches, tension headaches. This is really interesting. Hypnosis phenomena. The applications of hypnosis in medicine is based on different hypnotic phenomena. One of them is catalepsy. Catalepsy is widely used in stage hypnosis. Stage hypnosis is not approved through American Society of Clinical Hypnosis because it can be really dangerous for the subject. But the thing is, catalepsy is used a lot in stage hypnosis. Catalepsy is a nervous condition characterized by muscular rigidity, and it's widely seen in hypnosis. We use it a lot in some cases, because when you induce catalepsy, the pain is removed. So we use that as a tool for analgesia. And sometimes we use catalepsy as the induction technique. We can start with catalepsy, and if the catalepsy works, the subject goes to hypnosis fast. Post-hypnotic suggestion. One of the interesting things in hypnosis is the subject is still following the instructions or suggestions during the hypnosis, even after hypnosis. It is widely used in smoking cessation. You can induce like nausea or vomiting in your subject if he or she smokes a cigarette after hypnosis. Nowadays, it's not used because the modern hypnosis says that don't use direct suggestions in hypnosis. But years back, something like 20 or 30 years old, but years back, the hypnotherapists used to use post-hypnotic suggestions for hypnotherapy, for smoking cessation. Time distortion. In hypnosis, the subject most of the time loses his or her own perception of time. You can feel some 10 minutes, something like 1 hour, or 1 hour like 10 minutes. It depends on how is your feeling during hypnosis. If you're happy during hypnosis, then you feel the time distortion in terms of being shortened. And vice versa. If you have a bad experience, if you're recalling a bad memory, it's like a longer time period. Ideomotor responses, which are really interesting and they're widely used to communicate with dissociated, highly hypnotizable people, because sometimes you lose the communication channel with your subject. So ideomotor signs help you to communicate with your subject. Age regression, which is really interesting, because not only you experience your childhood memories, even your physical appearance changes, your facial expression changes, even your voice changes. And this is really interesting to me. There is a sign called Babinski test. You know, infants are Babinski negative, Babinski positive, up to age 8 months. After 8 months, if a human being is Babinski positive, it shows an upper motor neuron disease, like a tumor in the brain or something, and it's a serious condition. But if you hypnotize someone and he or she goes to the age of 2, the Babinski test is still negative. But if he or she goes to the age of 5 months old or 3 months old, the Babinski test becomes positive. And it's really interesting. If you do the test with a doctor, you may say that the doctor knows about Babinski test, maybe unconsciously, and he or she is pretending the Babinski is positive. But if you do the test with an engineer, that you know that definitely they don't know anything about Babinski test, they still, when they go to the